Before we start today's podcast, can whoever is spreading rumours that 5G is causing coronavirus or assisting with the spread of coronavirus, can you please, for the love of all that is holy, stop propagating crap like this? Hello and welcome to A Doctor's View, a podcast discussing everyday topics in health, fitness and mental well-being, as well as providing an insight into medical life and its challenges. Please note that all opinions are my own and should not replace the advice given to you by your own doctor. I'm Dr. Bolivios. Let's begin. Hello everyone, welcome to Doctor's View. I'm Dr. Bolivios. Today's episode comes from a different location to normal. I'm not in my normal setup. I'm actually in a hotel room, which was kindly offered by the people at Premier Inn, and I want to thank them for that. And they have provided accommodation for NHS workers at their hotels that are near hospitals. And that's allowed a lot of NHS staff who need to protect their family or are protecting themselves from relatives who are self-isolating, and it allows them to still go to work, and I want to thank them for that. So I'm here to protect some family members because I'm exposed to coronavirus, COVID-19 on a daily basis and in a substantial way, given that I'm working in the intensive care unit in the hospital. And the thought of making a family member very unwell and potentially causing a huge amount of harm to them is not something that sits very nicely. So I want to thank them for that. I had actually planned on publishing a different episode today, but I thought I would give an update as to the conditions at the moment and just what the last few shifts have meant and what they've shown me in the last few days. So I had a few days off as part of my rota. It was a small respite period, and I went back the other day doing a long day. Our shifts are about 12 and a half hours long, and I did a night shift last night, and I can honestly say that a few days has made such a difference. I was expecting there to be a lot more patients, and there were. However, it's still unnerving to see the rate at which it spread. It went from a few beds being taken up, about a week ago to so many more, to the point where, we're filling up now. And it is astonishing that people are still not taking this seriously. As we speak, our Prime Minister, Boris Johnson, is in hospital, and I think that just goes to show there is no prejudice with this virus. It can affect anyone and everyone. I wanted to give some thoughts of my personal views and how it's affected me, and also what I think are the most challenging aspects of working in the hospital at the moment, as well as there being a huge number of patients coming in with conditions that we haven't treated before. This is not something that is behaving like a normal respiratory virus, a normal pneumonia. It's behaving in a different way, and we're still evolving our treatments for this, as is everyone in the world. We're getting better. There's been more advice, and we're listening to lectures by prominent members who have dealt with this in other countries, and we're gaining experience from not only ourselves but also everyone else. And so our treatments are still evolving. There is still no cure. We can only manage symptoms. We can only manage the respiratory side of things in terms of being able to supplement someone's oxygen and breathe for them with the ventilator. But it's the way we do that which is constantly evolving. For me, the most difficult part of this is not being able to be the the doctor that I wanted to be. And I'll explain what I mean by that. When someone signs up for the vocation that is medicine, on the whole, they want to do the best they can for a patient. They want to treat not just the patient, but also the family as well. There's a big part of a treatment plan, a management plan, does incorporate the family. Sometimes you wish it didn't because of various reasons, but we do our best and we want to incorporate family as much as possible, and we want them to make sure that they understand that their relatives are being taken care of well, and we want them to have as much input as possible, and we also want them to be able to see their relatives. What's been increasingly difficult with this is answering a phone and having to explain over the phone how someone is doing, and when someone's not doing well, explaining that they're unable to come and visit because of how contagious this disease is. There's different guidelines evolving for how we can do this, and unfortunately nothing sits quite right just yet, and it's a very difficult thing to explain to a relative of someone who's dying that they're not able to visit their relative or loved one. And yeah, I think that's the most difficult thing at the moment. Other things that have been very, very challenging is seeing this disease process evolve in a patient that is otherwise well. I know we've been talking about in the media that it's mainly affecting over 80s or over 60s, 70s, and people with pre-existing comorbidities, things like heart disease, diabetes, and other things like that. In reality, that is true. They are the most affected. However, as time's been going on, I've been seeing more and more younger patients, and they are still suffering with it to the same degree when they're coming into the hospital. They are really unwell. And the other very perturbing thing is when you see them and they come in, they're doing okay on the ward, and then all of a sudden things go downhill. And this seems to be a general pattern, which you can see happens with, say, Boris Johnson, for example. He was able to cope up to a point, and then things deteriorated to the point where he needed to go into hospital. And it just goes to show that it's a long stint recovering from this. It's not a case of 1 or 2 days like a normal cold or even a flu, where you've got a week or so and things start to improve. This is very different. This could go on for several weeks, and you could feel well or able to cope at home or even on a hospital ward, a normal hospital ward with some supplementary oxygen for a week or so, and then all of a sudden you're finding yourself being transferred to intensive care. And I just want to reiterate just how important the social isolation aspect of all this is. It's been rumoured that, or I've read at least, that if social isolation didn't take place, the death toll within the UK would be around 600,000. I actually think it would be more, personally, just looking at the numbers. I think I haven't looked today, but we've had around 50-something thousand confirmed cases, and we've had approximately just over 5,000 deaths. I'm sure it's closer to 6,000 by the time I finish this recording. And so that's 10% of patients that are confirmed with COVID-19 are passing away. So I do believe that the number would be higher. So the social isolation aspect is actually very, very important. Despite warnings from so many people, from the government, from health ministers, from hospitals, from prominent members of the medical community. The message, I feel, still is not there. It still hasn't struck people. I went earlier to try and find some food, and it was staggering, just the number of people in complete disregard of any form of social distancing. They were not 2 meters away from each other. It makes going around, albeit small shop, very difficult. But even just in the street where there's ample space, there was still so much close contact going on within large groups, and just within different people who clearly weren't part of the same household or area. And I just can't understand why it's taking so much. What will it take for this message to go through? I don't understand. I've still had people say to me that this is like the flu and this is nothing to worry about. I can say hand on heart and from experience that this is completely different, and how we can be taking it lightly, I don't know. When you see the way it affects someone, the way it's affecting people's physiology, their lungs, their behavior, the ability to breathe and oxygenate their bodies, it's so awful. It really is horrendous. When you're seeing someone struggle for breath, for me, that's one of the most upsetting things in medicine, actually. As well, there's so many things that are upsetting in the hospital and in medicine, but on the whole, they can be dealt with in some way. So if someone's in pain, you can deal with that. You can offer them analgesia. If someone's been given bad news, there's things that can help with that. It doesn't take things away, of course, but there are ways to deal with it. But nothing is quite the same as when you see someone unable to breathe and they're struggling and they're doing their best to breathe, and you're giving all the help you can and they're still struggling. And when the other day a patient looked at me in the eyes and said, "I'm scared," it was a different type of scared. I have patients all the time telling me I'm scared, and when I anaesthetize them for an operation or something similar. And I've always been able to comfort them as best I can. And sometimes we make a joke. I might even say something like, "I'd be scared if you weren't, because this isn't a natural thing to go through. So don't worry, you'll be fine." And we laugh, and sometimes some banter, and things go okay. This time, it was a different type. It was a petrified form of scared. It was one where the patient felt they were not going to make it. And it's very difficult to try and comfort someone in a position like that, in such a state, because it's hard to say with any form of confidence, "Don't worry, you're going to be fine." And I think I may have said that, or I may have said something reassuring. I actually can't remember. But it's hard to make it sound convincing when you're not sure yourself. And unfortunately, the number of patients that we're seeing now is increasing, as I'm sure you're all aware from just reading the news or watching TV. The numbers are going up, and we're still waiting for the social isolation period, that the lockdown that we've had for a couple of weeks now. we're still waiting for the benefits of that to come in, because there's a time lag between being infected and developing symptoms. So we should start seeing that, albeit in a week or so. But unfortunately, there is the issue that, as I've said before, the message is still not reaching some people, or not getting through about how important this is. The other day, I turned on the news and heard about the park in London, and how rammed it was over the weekend because it was a nice day. I despaired. I was actually working that day and seeing referrals that day, so seeing people that potentially needed intensive care support, and I just felt like I wanted to scream. It was absolutely ridiculous just seeing these images of people crowded together in a busy park in the time that we're in. And I just want to say to someone thinking of doing this, or or people that were in that park, I don't wish any harm on anybody at all, ever. And if heaven forbid you were to develop these symptoms and be infected as a consequence of that day, was it worth it? Because I see what this virus does, and I see the way people are suffering with it. And I'm sure if you were to ask any of them, they would have a lot to say to you. And to some extent, even worse, if you were to be admitted into hospital and you look to your left, you look to your right, and there's people there struggling for life. And there's the thought of, would that visit have prevented that? Would my visit have prevented these people from being sick? Because when you look at the way something spreads, it's almost like a butterfly effect. And it's incredible how something that you can't see spreads, and you don't realize how easily it can spread. So I think we have exhausted this, but in terms of giving this message, but yet it's still not getting across to people. And my short trip to the shop to get a sandwich earlier on today, it just reiterates that fact. I think it is ridiculous. I've seen in the news recently some articles, and I was a little bit annoyed by them because I felt that they gave a sense of security, a false sense of security. And one of these articles was actually by a prominent statistician. He mentioned something about the statistics of dying with coronavirus versus the risks of dying normally, naturally. And the general gist of the article was that the risk of dying with coronavirus after being infected with coronavirus when you're over the age of 80 is approximately 10%. And this is exactly the same, or near as makes no difference, the same as the risk of dying within the next year if you're over 80 anyway. As in 1 in 10 of over 80-year-olds will die within the next year anyway, regardless. Now, at face value, I understand what the article was trying to say. However, I believe that doesn't tell you the whole truth. And the reason why is because, yes, we can say that based on the facts, the figures that we have, that 10% of over 80-year-olds are dying with coronavirus. However, it doesn't mention the fact that the reason it's only 10% of over 80-year-olds is because of medical treatment and because of social isolation measures. So if those things didn't exist, that number would be stratospheric. It would be so much higher. It wouldn't surprise me if it was 60% and up. Whereas the risk of dying without coronavirus over the age of 80 won't change too much without the elective hospital treatment that is not being carried out at the moment. So I think it's almost irresponsible to say facts like that without mentioning the entire aspect of the story. The other thing about facts like that is we don't know how many people are dying who haven't been tested for coronavirus. There's a lot of people out there over the age of 80 that are passing away, and we don't know if they do have coronavirus or not. They haven't been tested, and they may have only had some mild symptoms, or they may have had an exacerbation of a pre-existing condition that coronavirus has been the catalyst for causing the mechanism of death. We don't know because there is no testing. On the note of testing, that's something I'm finding increasingly frustrating. From a frontline worker, from a key worker perspective, testing for healthcare workers at the moment is absolutely shit. It is whatever news I'm hearing saying that it's a priority and that we must ensure that our key workers are being tested, our NHS staff are being tested. Personal experience or chatting to people closely about this, it seems to be different from the truth. There still seems to be a lot of loops to jump through. It's not done in a timely fashion, and quite frankly, I just can't understand why. It's something that could help so many people know whether they have this virus or not, albeit it's still not 100% accurate. We are aware of this, but it will let people know the precautions they need to take at home. It will allow people to return to work sooner. And this is the thing, a lot of people have wanted to go back to work, but they can't because they've exhibited some symptoms. Whether these symptoms are from corona or not, we don't know. But because of the lack of testing, they've had to stay self-isolated for the full duration as advised. And a simple test could mean they could go back to some shifts earlier. And they want to do that, and they just cannot understand why. And I can't understand why. So I just find this actually unbelievable. There is another aspect to this working within a hospital as a doctor, nurse, healthcare worker of all different specialties, from the security staff to the cleaning staff to the catering staff. And the one thing that we've focused a lot about on this podcast is burnout in the workplace. And we've chatted to some members about this and people's experiences of this, and we've tried to find ways of seeing how we can get through burnout and how we can eradicate it. And we're now in a situation where the ability or the susceptibility for burnout is huge, given that we're dealing with something that is requiring a huge amount of effort from everyone. Annual leave is being cancelled, rotas have been changed, people are finding themselves working in environments that they're not used to working in, and having to use all the skills that they have acquired in ways that they didn't know that they could use them. And these are very stressful times, seeing patients that are dying in front of you on a regular basis, that no matter what you're doing to help them, they're not improving. The disease process is just too strong. And these are all things that can contribute to developing burnout. There's other factors too, from a personal point of view as well. It's the being unable to see your family. and like I said, I'm in a hotel room now. I would rather be at home and talk to my family and have dinner with them and chat about various things, but because of their safety, I can't do that. And that's the same for a lot of people out there. And the isolation side of things is a very, very big factor, I believe, in making us very susceptible to having periods of depression, periods of burnout. Doesn't matter how introverted you may be or how much you enjoy your own company, everyone is susceptible to this. And it's very important to try and communicate in other ways. I've been using FaceTime and all sorts of social media ways and trying to communicate with other people, including getting in touch with friends and family who I haven't spoken to in a very long time. And in that sense, it's been nice and it has been something that's helped. But please make sure you do look after yourselves in that sense and ensure that you do seek help if you are a healthcare worker or a key worker and you're finding that things are getting a little bit much. Do talk to someone. It's not a sign of weakness. It's something that I think is important. People will understand. They do understand. And it wouldn't surprise me if people may come to you for help and support, and you realize you can relate to some of the things that they've been saying to you. So it's just something I wanted to put out there to let people be aware of this and to make sure that they're becoming self-aware. So I'll end this podcast there. Thank you for joining me today. I do apologize if there's been some background noise or the audio hasn't been very good, and there is a fan that I can't turn off, and I'll do my best to try and get rid of that. But I will keep you updated with any new developments that I have and anything that happens during my shifts that I think would be worth sharing. I will try and put out some episodes or some posts as best I can. Please do follow me on Instagram. I'll put some photos of my current setup on there, and my handle is @adoctorsview. And if you have any topics or any questions that you'd like to ask me and you want me to discuss in the future, please do email me at adoctorsview@gmail.com. Thank you so much for listening, and as always, please look after yourselves. Please stay safe. Please stay indoors. Wash your hands, and please look after those around you as well. It's something that we all have to do, and it's something that matters to everyone, and we have to be responsible as human beings, because as I said in a episode a few weeks ago, let's not let historians look back at this time in complete disbelief, and for them to look back at the footage of us going around in parks and sunbathing and shaking their heads. This is something we all have to fight, and I wish you all the very, very best, and I look forward to joining you again next time. I'm Dr. Bolivios. Goodbye.